Let's talk about psychedelic research, past, present, and future, the historical foundations, the great revival, and breakthroughs in clinical trials, and a hopeful future. We must honor Indigenous roots. Long before medical trials, long before the Western specific interest in psychedelics, they've been used for healing and spiritual guidance and community connection and community building for thousands of years by many different Indigenous cultures on every single continent. An important story for everyone to understand who's going to be working with these medicines. One of many, many stories of Indigenous practitioners is the story of Maria Sabina. In the 1950s, she was a Mazatec curandera in Huautla de Jimenez in Mexico. And she shared her sacred mushroom ceremony with a Western researcher named Gordon Wasson and his wife, Victoria. She was very hesitant to share these medicines, and she was pressured by them to give them a velada, a mushroom ceremony. They had heard about some wild ceremonies in Mexico and had traveled down there to reach some kind of medicine person and found Maria. Maria's teachings became the foundation to the West's understanding of psilocybin healing potential. However, this Western discovery of psychedelics are often overlooked, and the cultural, spiritual, and ancestral context from which these medicines were used. In the picture here of Life magazine, the Wassons went back to the United States and told their story, their incredible mushroom journey story, to Life magazine, which was published and widely available. And this resulted in thousands of pilgrims traveling to Huautla de Jimenez in search of a mushroom journey. This overran the town, and Maria Sabina was shunned by the locals. Her house was burned down, and she actually died years later, almost starving and alone. This is a cautionary tale to remind us how important it is to honor the Indigenous wisdom and acknowledge that these medicines have always been part of healing traditions. It is essential that we give credit where credit is due and honor reciprocity when working with these medicines. So then, as psychedelics moved into the West, there was scientific and psychiatric curiosity in the mid-20th century. Some early key discoveries were, in 1958, Albert Hofmann was a chemist, and he discovered LSD. He also successfully isolated psilocybin from the mushrooms used in Mazatec ceremonies. Early research explored LSD, psilocybin, and mescaline as potential treatments for mental health disorders, including depression, anxiety, and addiction. It's pretty wild to think that this research has been going on for decades, and then there was an era of prohibition that suppressed all of this research from coming forward, and we had to circle back and continue the research much later. Psychedelics were seen as tools for exploring consciousness and unlocking therapeutic breakthroughs for patients resistant to traditional treatments. Then there was the Great Revival. After decades of hiatus due to regulatory restrictions, psychedelic research quietly returned in the 1990s, led by a few pioneering scientists who recognized the untapped therapeutic potential of these substances. In the 1990s, Rick Strassman did DMT research. At the University of New Mexico, Dr. Strassman conducted the first government-approved psychedelic study in decades, administering DMT to volunteers. The Johns Hopkins study in 2006 showed that a single high dose of psilocybin produced sustained improvements in both mood and well-being for months afterward. And then there's the MAPS and MDMA research. Pictured here in this slide is Rick Doblin, who established the Multidisciplinary Association for Psychedelic Studies, also popularly known as MAPS. MAPS, founded by Rick, began its mission to make MDMA an FDA-approved treatment for PTSD. MAPS was established in 1986 as a nonprofit. In the early 2000s, MAPS secured regulatory approval for the first modern MDMA-assisted therapy trial. And there's so much research coming out every single day. Recent research has brought unprecedented advancements in psychedelic research, and it's pushed these therapies into mainstream media and mainstream clinical use. The rigorous studies of FDA breakthrough therapy designation have moved psychedelics from a fringe interest to potential game changers in mental health care. Every day we're hearing stories about how psychedelics have profoundly changed people's lives. So let's explore a few of these studies. And there are so many studies you can research and look up, but these are some of the highlights with each medicine. In 2018, there was a ketamine treatment study for treatment-resistant depression. It was a randomized, controlled trial. 64% of patients receiving a single infusion of ketamine achieved a clinically significant reduction in their depression symptoms. Additionally, 29% of patients received full remission. There are no psychotropic medications that can even compete with these numbers. Effects were rapid, with significant improvement seen within 4 hours. 53% of patients with suicidal ideation experienced complete resolution within 24 hours. In fact, when we discovered that ketamine had potential for psychiatric use, it was in emergency rooms with suicidal patients. ER doctors were discovering that when they administered ketamine for anesthesia, it also correlated to a significant reduction in suicidality. And this was what inspired creative and curious clinicians to start exploring ketamine for psychiatric use. Let's talk about the 2022 COMP360 study. This study was with psilocybin. COMP360, which was sponsored by Compass, explored how psilocybin could alleviate treatment-resistant depression. And remember, treatment-resistant depression is when people have tried every single other method and there's nothing that has worked. But this study showed that approximately 30% of patients in the 25 milligram group were in remission at week 3. And the patients who received a single 25 milligram dose of COMP360 psilocybin combined with psychological support, important to note, psychological support, that's where we come in. They experienced a rapid and statistically significant reduction in depression symptoms within just 3 weeks. In the prestigious journal Nature in 2023, the MAP2 study showed that 86.5% of the participants treated with MDMA had a clinically significant improvement in their PTSD symptoms, and 71% no longer qualified for a PTSD diagnosis. This is incredible, 86.5% of patients. In 2024, the very prestigious Shepherd Pratt studied psilocybin and found that a trial of participants with severe treatment-resistant depression, 50% experienced a clinically significant reduction in symptoms after a single dose of psilocybin. 20% achieved full remission by the 4-week follow-up. This is absolutely unheard of with classic psychotropic medications. These numbers are incredible. 50%, 20% full remission. These results highlight the potential of psilocybin to provide rapid relief in difficult to treat depression cases. This creates such a hopeful future for mainstreaming psychedelics. In a paper published in the American Journal of Psychiatry in 2025, the Veteran Health Administration, known as the VA, is proactively planning for a future where psychedelic-assisted psychotherapy can become part of mainstream healthcare. They are collaborating with federal agencies like the FDA, the NIH, the Department of Defense, and the SAMHSA. The VA is laying the groundwork to provide safe and scalable access to treatments like MDMA for PTSD and psilocybin for depression. And this strategic approach includes building partnerships with academic institutions, community organizations, and industry leaders to ensure equitable access and long-term support. With the largest integrative healthcare system in the US, the VA, preparing to adopt psychedelic therapy, this signals a promising shift toward the normalization of psychedelic therapies in clinical practice. And this offers us new hope for individuals with treatment-resistant depression and other related conditions.